Ultrasound. What is the first thought in your head when you hear that word? Mothers? Babies? Before I wanted to be an ultrasound technician, baby is exactly what I thought of. Ultrasound technicians play an important role in the diagnosis process. Gallstones? Ultrasound. Kidney malformation? Ultrasound. Ultrasounds give the ability to look beneath the surface without the need for invasive procedures, and has completely revolutionized the way we diagnose and treat medical conditions. With the broad amount of diagnostic imaging available, ultrasound plays a vital role in a niche specialization, reproductive diagnostics. With reproductive diagnostics, ultrasound technicians play a vital role in unveiling the intricacies on female reproductive organs, from adolescence to postmenopausal. In women's health, ultrasounds are a powerful tool to early detection and management of reproductive disorders. Today we will discuss what reproductive diagnostics is, how technicians give reassurance in care, and diagnosing and monitoring diseases in fetal development. Before we begin speaking about reproductive diagnostics, we need to know what it is. Ultrasound technicians will use either a transvaginal Doppler or a normal Doppler with a full bladder, and they will use sound waves to look at the reproductive organs. Using ultrasounds can help with early diagnosis of diseases like PCOS, endometriosis, and uterine fibroids. Accurate diagnosis guides healthcare providers to tailor plans to your treatment. Now that we know what reproductive diagnostics is, we can discuss further how the ultrasound technicians plays a vital role in reassurance and care. Imagine a young woman coming in the first time, or maybe even the 20th time, not knowing what to expect or what the results will be. This is when becoming reassuring to the patient becomes important. Being compassionate and guiding the patient thoroughly with each step can provide clarity and comfort. During the procedure, you're the only one between the patient and the healthcare provider. It is up to you to provide a sense of security. While being a reassuring technician is vital, you also have the ability to be a part of the diagnosis of diseases like PCOS and fetal development. According to Michael T. Sheehan at the Marshfield Clinic, 4 to 12% of women are affected with PCOS, or polycystic ovarian syndrome. A patient may come in with symptoms of uncontrolled weight gain, excessive bodily hair, and infertility, says Guter. The ultrasound technician will use a transvaginal ultrasound to look at the patient's ovaries. Then we'll point out any of the abnormalities, like an abundance of large fluid-filled sacs on the ovaries, to the provider who will give the final diagnosis. An ultrasound technician in fetal development does not just show the cute pictures of the fetus to the mother. Although that is a plus, the 20-week anatomy scan is the most important scan in fetal development. This is when all the internal organs of the fetus are examined, as well as the baby's length of the extremities, according to Dr. Richard Brown. This anatomy scan allows the healthcare providers to plan for the fetus once they are born, if there are any abnormalities. Ultimately, ultrasound technicians are the middlemen in being reassuring providers, diagnosing reproductive disorders like PCOS, and scanning fetal development. With just using sound waves and looking at what seems to be just a grainy screen, ultrasound technicians have the ability to see between the grains and aid in the diagnosis.